Sir, Unnara?
Sir.
Srinath, sir.
Recording in progress.
Hello.
Yes, sir.
Yeah. Good evening. Can we start, Naveen?
Yes, sir.
Okay. So, good evening to all. It's my pleasure to introduce you for today's program on first aid, save lives. Each and every citizen should be aware of this. That is the motto of today's session. As part of the World First Aid Day, which is on the 9th of September to September every year, it's been considered. As doctors, nurses, paramedics, general public, everybody, we should know what is the CPR, that is cardiopulmonary resuscitation, and various other things which has to be done when a victim is present in front of you. You are the first doctor. That's what we always say for the general public. In the same way, we as healthcare providers should also know what we have to teach. In this perspective, today's session is very, very important for each and everyone. And each and everyone as a citizen of this country or being in the world, we should be aware what we have to do. When a patient comes, says that he has a chest pain, or there are signs of which are important as stroke, or there is a burns, or there is a poisoning, or there is an accident, or a patient is unconscious. Like this, various scenarios come across in our day-to-day life. And when we know this, how we have to do, then it becomes important in saving the life. When you save such life, you will feel more enthusiastic and more perturbed, because it may be your near ones when you're going to save it. And it's important that you all have to know that previously, when a cardiac arrest happens, it's usually in the elderly age group. Today, we are seeing as young as 25, 26 years. And you would have seen a lot of film stars and various personalities having a sudden cardiac arrest. And at that particular moment, not many were aware what they are supposed to do in that situation. So today's session will be helpful for them. And the second scenario is accidents. Day in and day out, we see n number of accidents. Every second, there is an accident in our country. And every 3 minutes, a life is lost because of an accident. In this situation, we all speak about golden hour, platinum seconds, platinum minutes. But as a citizen, as a healthcare provider, what you're supposed to do is very, very important that in that particular situation. So to know everything about such problems, we have our eminent speaker today, Dr. Naveen Nimmala, who will be telling each and every scenario and describe it and how you have to take care in that particular moment. Over to you, Dr. Naveen, and all the best for all the listeners. And if somebody is not listening today, it's very important to carry on the message. And to end it, I always keep telling everybody, each one should teach one to save more lives. So whosoever has heard today should pass on the message to another person and ask them to say to the another person regarding what is the first aid, what they can do as a person in their real life. When you save a life, you always feel you're an hero. That's what we keep telling each other. So with this mission, handing over to Dr. Nevin. Thank you very much.
Thank you, sir. We will be starting our session. So today's topic is first aid. So how to save a life as a non-medical person. So you don't have to be from a medical field to save a life. So the initial help that you offer is unmatched, whether if there is a delay in providing help, and if you take them to the hospital after a delay, no matter how many specialists are there, they will not be able to help that victim as effectively as if someone has done a first aid in that case. So first aid is very much important. You are the doctor, you are the hospital in that situation. So the objectives for today are how to spot an emergency and when to help someone and what not to do. Sometimes people think that they're helping and they do something. For example, if it's an accident case, everyone feels like they need to offer water to the victim. So sometimes if that victim needs a surgery, that giving water can actually delay the surgery. So that way we need to know what to do and what not to do. In the same way, whom to dial. So 105910 is visible on the screen. That is our Yashoda emergency number. So whenever you need an ambulance from Yashoda, you get to dial this and we'll dispatch an ambulance. But we do have another number, that is national emergency number. Unfortunately, if we ask people what's our national emergency number for India, we get a lot of answers. Some say 100, 101, 102, 108. There are so many answers. But India also has one unified number, just like the US. People, or most of them know the US number for emergency is 911, but they don't know that 112 is there for India. So when you have a mobile phone that's in your hand, and if you want to dial an emergency, without having to unlock the phone, you can dial this number. So when you hit that emergency call, you're getting connected to 112. So you should know your emergency numbers nearby. If you're living near a hospital, you should know the ER contact. So whom to contact, how to contact the ER, how to get an ambulance. So that should be available. Nowadays, most of the modern communities do have some medical backup, but that's not 24/7. So especially in the nights, you should know how to get hold of an ambulance. So one of the major emergencies people might have to see in their colleagues or family members is heart attack. So this can happen at any age. Previously, we used to think that only elderly people get it, but post-COVID, everything has changed, and there are so many people that are suffering from heart attacks, even in the younger age. So how to spot it? If someone is having a gripping type of chest pain, that as if someone is sitting on the chest, and that pain is radiating to the left arm, neck, shoulder, and back. And this will be associated with sweating, a sense of vomiting, giddiness, palpitations, and shortness of breath. If these are all there, it is most likely pointing towards heart attack. But if you don't have all of these, sometimes you may feel like you're having only chest pain, only arm pain. Even then, you are not supposed to ignore. So if the pain is lasting for more than 10 minutes, go to a nearest emergency that is capable of taking care of emergency emergencies, and your risk goes up if you have the diabetes, heart disease, or blood pressure, or if you are a smoker. So smoking is one of the leading causes for heart attack. So giving up at any age is going to help you. So it's never too late. If you are a smoker currently, stop now. So heart attack and cardiac arrest are two different things. Heart attack can lead to cardiac arrest. Cardiac arrest means the heart has stopped to work. So heart's function is pumping. So that pumping has stopped now. So whenever there is a problem with either heart or brain, you have limited window within which you need to get the help. For example, if you're taking care of a plant, you need to water it maybe every day or every alternate day. But if the water supply is cut off for a week, some plants might come back, some plants might not come back if you water it the 8th day. But if you water it after 1 month, most of the plants will die. Similarly, your body parts also have blood supply that is equivalent to water to the plant. So if your blood supply is cut off, that is either heart attack or stroke, in that, if you don't restore it, you have a few hours within which you need to get that back to normal. Otherwise, the damage will be permanent. No matter how many lakhs or crores of rupees you spend after that window period is gone, you will never be able to get it back. So be active and be proactive. If it's a night, especially, people tend to postpone, thinking that I'll go in the morning or I will go with a friend. So let me call my friend first, wait 1 hour or 2 hours, then go to the ER. So that's a mistake. Always go to the nearest emergency. Nearest in the sense, if you are living in one part of the city and you have a friend who is working in the medical field, you have a doctor friend who is working at other end of the city. If the journey itself is going to take 1 hour, don't risk at that time. Go to the nearest emergency first. Then once you are stable enough, you can get shifted to the hospital where your friend is working. So how to spot a cardiac arrest? So whenever you see someone on the road or next to you, if someone collapses, there is a chance that maybe there is a cardiac arrest. First, check whether they are responding or not. So tap on their shoulders firmly. Even if they are in deep sleep, they should move a little. Tap and shout. If they don't respond, that means they need help. So you will not be able to offer help for a long time. In that case, you must ask for backup. That backup could be your friend or nearest emergency. Call and then see if they require CPR. Not every unconscious victim needs CPR. So you should know when to give CPR. Recently in social media, there have been a lot of CPR videos that get circulated. Most of the time, the victim keeps moving and they're still giving CPR. So CPR is not required if the victim is moving or if there is a pulse. So how to know whether to give CPR or not? First, check their pulse. Means if the heart is pumping, you will have pulse. How to check the pulse? First, put 2 fingers here, exactly in the midline first, then slide to one side and then press backwards. If there is a pulse, you will be able to feel it. So we are actually looking at this pulse. These are the carotids that supply the brain. So these are much bigger than the pulse we see regularly in the clinic. So this pulse is narrow, the artery is narrow, so you may not be able to appreciate much here. So to be sure, you have to check here. So that we call it as central pulse. So this checking should happen only 5 to 10 seconds, not more than that. Within 10 seconds, if you don't feel a pulse, imagine that there is no pulse and start CPR. And you can inform the hospital that someone's heart has stopped and we are giving CPR. And there is a machine that can deliver a shock and help with the cardiac arrest. So you can ask for it. You call it as AED. We'll look at the usage after some time. So when you're checking this, people should not check on both sides at the same time, because you might cut the blood supply to the brain and they might faint if they're semi-conscious. So how to do chest compressions? So you have checked the pulse and there is no pulse. And when you're checking for pulse, also look at the chest to make sure the chest is moving or not. So if the chest is not moving, that means they are not breathing. So if there is no pulse and breathing, that means they need CPR. So CPR full form is cardiopulmonary resuscitation. Cardio means heart. So heart's job is to pump the blood. So as it has stopped pumping, we need to pump from outside. How to do that? First, you need to put one hand in the center of the chest. So there is a bone in the center. We call it as sternum. On the lower half of the bone, you need to put your dominant hand, then add one more hand on it. So the second hand you can add and interlock your fingers. So fingers should be locked and in this position. So when you are giving CPR, your hand should be vertical, means shoulder, elbow, and wrist. All of those three joints should be in 90-degree angle. That means your body weight can actually help compress. Otherwise, you will be tired. So achieving this position is very crucial. So if someone is on a very soft mattress, if the mattress is this thick, and if you're compressing the victim on the mattress, sometimes the mattress will go down and your compression force is half wasted. So that's why they should be on a firm, flat surface. So when you're compressing, do not bend your elbows. Elbows should be straight. So this is how you start placing your hand in the center and interlock your fingers. Then you start to compress down. So your compression should be vertically down and your hand position should be in the lower half of the breastbone. So after 30 compressions, you deliver breaths like this. So you have to tilt the head back and deliver breaths. So hand position is like this, and this is how you compress. After 30 compressions are done, you will tilt the head back like this. So you will tilt the head back and pinch the nostrils. Nose is pinched, open the mouth and blow into the mouth. So each breath should be delivered over 1 second. So you'll give 2 breaths like that. So when you're giving compressions, your rate should be 100 to 120 per minute. So 100 to 120 compressions per minute. And depth. So depth depends on how big the personality is. If someone is very lean, they may need only 2 inches. If someone is very obese, very fat, they might require 3 inches or more. So you have to cover 1/3 of the chest diameter. When you push down 1/3 of the chest, you should go in. And allowing the chest to recoil means whatever you compress, you have to let it come back. Say from here, you have gone down. Your hand position should come back to normal place. That we call it a chest recoil. Means when you press down, you're squeezing the heart to let the enter blood out of the heart. For the next compression to be effective, the heart needs to refill. So that refilling can occur only when you relax. So compress, relax, compress, relax. Like that, your CPR should go on. Your heart normally never stops. Your help also should never stop. So keep on continuing CPR until advanced help arrives. So if you have called for an ambulance, till the ambulance comes, you have to do CPR. Don't just do for 2 minutes and then if you are tired, ask someone else to do it or guide them. If they are not trained enough, at least guide them and let them do CPR. Do not stop CPR. So before you give breaths, I told you to tilt the head back. So when someone is lying flat, if they're unconscious, the tongue, you can notice here, the tongue is falling back and blocking. So if you extend the neck, you have a clear pathway now. So that's the reason we do this tilting. So this tilting should not be done if it's an accident case, because in accident case, you don't know whether the neck bones are broken or not. So if the neck has broken bones, this movement can actually harm the victim. So otherwise, in normal victims, you can do this head extension. So you have to do 30 compressions and 2 breaths. So what to do in trauma cases, like accident cases. In them, you cannot do head tilt. So in them, you can just put your hands like this, and this jaw, this lower jaw, we are actually pulling forward. That way, you are trying to lift the tongue forward. So we need to get this tongue forward. So that can be done with this jaw thrust procedure. So if it's a child, in a child that is like 4 or 5 years old, in them, sometimes you need not use two hands. In them, just one hand is enough. You can use one hand to compress. Again, the rate is same, 100 to 120 per minute. And the depth is also same, 1/3 of the chest you should cover. But one thing to remember in pediatric age group is the heart in them has stopped because of oxygenation issues. Means the lungs did not function properly or they did not breathe well. That is the reason the heart has stopped. That due to that, we need to give more breaths in kids. How can we deliver that? So in adults, we said give 30 compressions and 2 breaths. But in children, we can give 15 compressions and 2 breaths, especially if you have more people available. So if you have more people available, more breaths should be given. So more people, more breaths. 15:2, doubling the breaths compared to the adults. So in less than 1 year olds, the head size is comparatively larger than the body. So in them, the airway is naturally open. You need not extend the neck as in adults. So keep it in the neutral position and deliver breaths. The only difference when giving mouth to mouth is you will be covering both mouth and nose with your mouth. So there is no much space here. So both mouth and nose should be covered with your mouth and you deliver a breath. Whenever you are giving artificial breaths, make sure you look at the chest. If there is any slight chest movement, that means some air has entered into the lungs and it should be enough. Don't give too much of air. So normal oxygen concentration in any room air is 21%. When you take a deep breath and help somebody with artificial breaths, that will still contain about 17% of oxygen. So that's the reason breaths are important. But what if it's a stranger and you're not comfortable giving mouth to mouth to somebody? So if you have some kind of cloth, try to use it. If you're still uncomfortable, at least continue compressions. If you're not comfortable giving breaths, at least continue compressions. So in case of less than 1 year, we can use 2 fingers like this for compressions. So they have given 15 compressions and they're giving 2 breaths. So 15 compressions and 2 breaths because there is more than one person available here. So at any point when there are 2 people available, one person will be taking care of compressions, the other will be taking care of giving breaths. So that's how 2 people can help during CPR. So how long do we do this CPR? So we do this CPR for 2 minutes. At the end of 2 minutes, you will stop the CPR and then you switch positions. Means if you were giving compressions till that point, you will be tired. So ask someone else to take over. So it need not be 2 minutes. If you are tired after 1 minute, ask for help. Because CPR quality matters. And if you are tired, you cannot give proper CPR. And then check whether they need CPR or not. Sometimes if your CPR is of good quality and there is no major issue in the body, the heart might restart. So if the heart has restarted, again, obviously, they don't need CPR. So every 2 minutes, you have to check the pulse. If the pulse is back, CPR is not required. But if the pulse is not there, continue CPR. Or if the pulse is back and the ambulance is going to take 10 more minutes to reach. For that 10 more minutes, periodically, every minute, reassess. Sometimes the pulse might be lost again. So you have to keep them monitoring. So there is one machine that can be used by any person, even a non-medical person. That's been designed for usage by non-medical person. We call that as automated external defibrillator. So this should be made available in many of the places wherever there is a crowding possibility. So for example, all Kerala buses have AEDs available. And even recently, Telangana government has bought about 1400 AEDs, and they're going to put them wherever required. So it's high time that people are trained in usage. So all the RTC drivers should be trained properly. So that's already going on. That's a good thing. So this is a machine. So just like any other machine, you are supposed to turn it on first. Once you turn it on, it will give you voice prompts. Mostly it will be English, but it will be a simple English, so you can listen and follow it. So once you turn it on, it will say attach the pads. So pads you can attach. So these pads will have a mark on them, which one, where it goes, whether which one goes on the right, which one goes on the left, it will be marked on the pad. So put them where they go. Next, you have to connect it to the machine. So this machine will try to check whether a shock is helpful for that victim. So shock is not going to start the heart. So we give a shock to stop the heart. So if the heart is beating irregularly, this shock is going to stop it and reset it. Just like your PC, when it hangs, you press the reset button. But if the PC is dead, pressing the reset button is useless. Similarly, if the heart has no activity at all, giving a shock is of no use. Only if it's irregularly working, then shock is going to stop it, and if the heart is good enough, it will restart. So don't pressurize the hospital doctors and nurses to give a shock when you carry your friend or colleague in a cardiac arrest. So they know whether a shock is going to help or not. Let them do their job. Sometimes people come in and tell us that, doctor, give a shock. If you don't give a shock, sometimes they will feel like if unfortunately the victim doesn't survive, so they will start telling you that you did not give a shock or you don't have a shocking machine. That's why our victim is dead. So that's how that kind of mentality is there. So you should know the shock is useful only in some situations which the doctors already know they are going to do their job. So if this machine thinks shock is required, it will tell you. So there will be a button, shocking button on this machine. It will tell you when to press the button. So it is going to charge and it will tell you when to deliver a shock. But the only thing you're supposed to be careful during the usage is you have to make sure no one is touching the victim when you press the shock button, because these are attached to the victim. So when you press the shock button, the victim will be shocked. So the heart will be between these two pads. So if someone is touching the victim, they will also get a shock. So make sure no one is touching before you press the shock button. And immediately after shocking, you have to continue the CPR. So every 2 minutes, the machine will ask you to stop and it will reanalyze. One more emergency is choking. So when someone is not fully conscious, or if they happen to take a big piece of meat or something, sometimes it can be stuck in the throat. So when that is stuck, they will give you a hint that they are having a breathing problem by holding this. So they will hold the neck and try to give you a hint. So that is the choking sign. When someone is choking, that means they are not able to breathe. So if the obstruction is full-fledged, means if there is a complete obstruction, the air will not come out. So if the air doesn't come out, they cannot talk or make a sound. So what they can do is they can either clap or hit on a table or something to indicate that they are having a problem. So in that case, we have to stand behind them and exert pressure into the abdomen. So when you push the abdomen back, so there will be some pressure generated in the abdomen. So that pressure will be pushed into the chest. So that pressure gets transmitted into the chest, and chest has lungs which are filled with air. So it's like you're pushing a balloon. So when you push a balloon, that air might gush out forcefully. So when that air is coming out forcefully, whatever is blocking the throat can actually come out. So that's the idea behind exerting the pressure in the abdomen. So in case of children, you can compress directly on the chest or tap on the back. So we call them as back blows and chest thrusts. If someone is of this size, you, instead of standing behind them, you can kneel down behind them and you do the same thing again. So you are exerting the pressure in the abdomen and you're trying to hope that whatever is blocking will come out. So what if you are alone? So there is no one to stand behind you and perform this maneuver. We call that as Heimlich maneuver. So if someone is not available, you can help yourself by making a fist and then exerting pressure in the abdomen. So that way you're doing the same, but by yourself. So this simple technique can actually keep you alive for the next day. Otherwise, you will be dead. So this is about the choking relief. Next emergency that is very much time sensitive is stroke. So unlike the heart, you have much more less time in the stroke. So in case of heart attack, sometimes even 10-12 hours is also acceptable. But in case of stroke, 3 to 4.5 hours is what we say. So within that time, the sooner the better. So how to spot a stroke? The mnemonic is be fast. In that, B means balance off. If someone is not able to walk properly, not able to stand, and they're falling off, they're not able to balance themselves. If the vision is blurry or lost, if the face is drooping, one side the face is drooping suddenly or going to one side, or if you ask them to put their hands in front, if one arm is weak, it will start to drift down. And if their speech was all good before, now it's all slurry and you are not able to understand, that is one more thing. One more thing is terrible headache. If they have severe headache, that is also a sign of stroke. If you have any of these signs, you need not have all of them. Even one sign is enough hint that you are having a stroke. Make sure you go to the hospital immediately without waiting for anybody. Don't think that my friend is on the way, he'll pick me up and all. So whichever vehicle you get hold of, go to emergency immediately, because if you come on time, sometimes we can offer you an injection that can lyse the clot. That means that can dissolve the clot and restore the blood supply to the vital parts of the brain. But again, there are two kinds of stroke. One is blockage of blood supply. The other is leakage of blood supply. In case of leakage, depends on if it's a small leak or big leak. Sometimes you might require a surgery. If it's a blockage, we need to clear that blockage. Again, we have a very limited window within which we can help. Once that window has passed, you will have that paralysis for life. So do not wait any longer if you have any of the stroke signs. Sometimes diabetic patients and all, or if someone is on fasting, if they did not have food for a long time, they might have low sugars, and that can also lead to these signs. If that's the case, you can give them the sugars. But again, do not give anything via mouth if they cannot swallow. First, see their sensorium. If they are oriented and they are still talking to you nicely, and they can, if you think that they can swallow, then only give. If they are already unconscious, don't give anything. So an unconscious victim cannot swallow properly. So whatever you give will actually go into the lungs and it can cause more damage. So semi-conscious, drowsy people should not be given anything via mouth. Only if they're conscious, give something. Next kind of emergency you need to know how to deal is accidents and injuries. Whenever there is an accident on the road, people stop. Some actually try to help. Some only want to see what happened. Some want to take some pictures. So before you go to that place, look at how safe it is for you to reach. Sometimes you are going on a highway and you see some victim on the road. That could be a trap. Someone is waiting to attack you and steal something from you. So whenever you are getting down, you have to make sure you inform somebody, call someone, tell them, keep them online, tell them you're going to approach someone to help. And one more important aspect during any accident is crowd control. Everyone stops there. So if you want someone to actually call the ambulance, don't say someone call the ambulance. Point at somebody, you call the ambulance. So once you point at someone, they will feel like they have the responsibility now, then only they will call. Otherwise, if you say someone call the ambulance, everyone will think that, okay, someone else will do it. Next is crowd control. So crowd control is important because the ambulance needs to arrive to that scene. But if there is a lot of traffic jam because of this accident and the ambulance cannot come, that a life might be lost. So managing the traffic is also a very good help at that time. If there is no imminent danger, do not move that victim unnecessarily. Simple help of stopping the bleed is going to make a lot of impact. If the patient, even if after coming to the hospital, so if they come to the hospital and after the, if the hospital is planning to do a surgery, but if the victim has lost a lot of blood and if that blood group is not available, again, they cannot do a surgery. So saving that blood by simple pressure is a huge help. And most of the times people tend to offer water. So what if they require a surgery after some time? In that case, the anesthesia people might say that we will wait some time till the stomach is actually free of anything. Otherwise, sometimes during OT procedures, they can actually vomit and that field will be nasty. So it's better if they are begging you for water, then you might give 1 or 2 sips, not more than that. Always move in the long axis to protect the spine. Means you can hold both the shoulders and drag them up, or you can hold both the legs and drag them down, but never pull one hand or one leg and move in the sideways. Never do that. So if someone is unconscious, so you have seen somebody have an accident and now they are unconscious, but there is a pulse. If there is pulse, they don't require CPR. So in that case, you can put them in recovery position. Because if someone is lying on the road and if they vomit, they cannot vomit it out. So all of it will enter into the lungs and it will lead to all the infections in the lung. So in that case, hold one hand, put them in supine position like this with face up, hold the hand and leg and pull towards you. So that way that hand should be below the face. And if they vomit, the vomit should fall from the angle of the mouth. So that way recovery position is going to help. Now, if you want to move someone to a hospital, so if imagine there is a fracture in the hand here. If both bones are fractured, if you move them without actually stabilizing this part, those broken bony ends can actually be very sharp and can cause more damage. That's why stabilizing that part, you don't require much specialized objects to do that. Simple sticks like this, anything to tie, or simple cardboard, just fold it around and you can actually make a splint to stabilize this part so that this bone will not move. So that way you have to apply a splint and move the victim. Another way to do is get hold of any sticks nearby or any pad kind of thing and then tie it. So any cardboard or wooden board that you get hold of, you can use and splint it. So this is one way to stabilize the fractured part. If you have a simple sprain, so ligament tears can be very painful. So for that, there is actually most of the times you won't be requiring any surgeries. So in that case, all you need is rest, immobilization, apply cold compression, and elevate the limbs. Elevate the limb in the sense, if you're sleeping, during that time, put a couple of pillows and put your leg over the pillow. If you're sitting, get hold of another chair, put your leg over that chair. So that way, if your leg is at a higher level, you will not have swelling. Otherwise, your leg will start to swell. In case of ligament sprains, rest is required for a long time. If you start moving before it heals, again, you will require that much of, say, if your doctor advises 2 weeks of rest, you should not start moving or putting weight on that part for 2 weeks. If you take 1 week rest and then start to move, if that ligament is damaged again, you will require another 2 weeks or 3 weeks of rest now. So never ignore the rest part, that is absolutely required. Ligament injuries will take time to heal, so you have to respect whatever your doctor has advised. So if there is a trauma patient, we generally use this log roll so that even if the back is damaged, back spine is damaged, so that we move entire body like a log. We call this as log roll. And to protect the spine, we move them on the spine board. So if your friend is suffering from asthma, you should know where his or her medication is and how to use it. And also, if you are suffering from asthma, you should tell your friends about which inhaler you are using and how you use it. So most of the times, say if you have an asthma attack because of some allergy or something, you will start to cough, you will start to have wheeze that is audible to others, and your skin will start to have blue skin because of oxygenation issues. During that time, someone should bring you that inhaler. So just 2 or 3 puffs of that inhaler are going to make a lot of difference in the suffering. So they will start to feel better once they take a couple of puffs, and then you can go to the hospital. So that way you should know how to use an inhaler and where is that inhaler located. So sometimes people feel weird to tell others about their health problems. Not everyone is open to that, but be open, tell your colleagues about your medical issues and what you do in case of an emergency. Nosebleeds. Most of the times we see these on a Saturday night. So people probably had a bar fight and they come to the ER. When we ask them what happened, they tell, I've hit a door. Yes, we trust you. You might have really hit a door. But during that time, some people tend to come to the ER and some just want to stay back at house. If that nose is damaged and the shaped out, in that case, don't try to straighten it. Come get an X-ray done, or sometimes we may have to do a CT also. So in that case, if the nose is actively bleeding, you should maintain this position. You should be either sitting or standing. If you go back like this, the blood leakage will be into the mouth and you keep swallowing it. You never know how much of blood you are losing. So that's why your head should be slightly forward. So blood should come out, not in. So if it's not because of trauma, sometimes people have spontaneous bleeds. So maybe they were picking in the nose, or they tried to pull the hair from the nose and they started bleeding. So in that case, you have to actually pinch the nostril for 5 minutes. When I say 5 minutes, it's 5 minutes. Sometimes we get a call to the ER saying, I'm having a nosebleed, it's not stopping. We tell them to pinch and hold for 5 minutes, and if it still doesn't stop, you may come to the ER. In 1 or 2 minutes, we get the call again. Doctor, I tried, it's still not stopping. So that's how it is. In 1 or 2 minutes, sometimes it won't stop. You have to keep a steady pressure for 5 minutes. You can't just pinch. Did it stop? Again, pinch. Don't try to test whether it has stopped or not. Okay. So pinch for a long time and seek medical attention. If it's an epilepsy, means seizure, fits. So if someone is having fits, what is the first thing people do? Most of the times, at least in India, they get hold of a keychain. So the magical keychain, people think that it works. For this, I keep telling a story to others, like there is a dog, male dog on one side of the platform, and there is a female dog on the other side of the platform. So now there is a train coming in. So the field of view is gone. So this dog is not able to see his girlfriend. So now this dog is angry and it starts to bark. So once it starts to bark, within 1 minute, this train leaves. Now this dog thinks that, oh, I threatened this train and it has left. So that's how it is. Now, the real thing is, whether this dog shouts or not, the train is going to stay for 1 or 2 minutes in a station. So this dog goes and tells all the other dogs that the train leaves if we bark at the train. So now all the dogs go and test it in different platforms. Every dog has the similar finding. So now they make a theory that by barking, the train will be afraid and it leaves the station. So that's how it is. This story was told by Dr. Rajiv on a webinar. I heard it there, but I applied it here. So that's how keys came into effect. Keys don't actually work. Actually, nothing works during a seizure. So most of the times, the seizures will stop by themselves. Whether you do something or not, the seizures will stop. Majority of them. There are some cases it will stop, continue for a long time, but most of the times they stop. So during that time, if you dance, the seizures will stop. If you stand on a single leg, again, the seizures will stop. You will start thinking that because I was standing on one leg, it stopped. Or maybe you can sing, again, same thing. Whatever you do, the seizures will stop. So someone was holding a key during that time and it stopped, and they thought keys will stop the seizure, and everyone started to believing it. If the keys really work, the victim himself who has seizures history will actually put a key here and get it taped. Problem solved, right? So we have seen what is not going to work. So what to do if someone is seizing in front of you? So don't hold the victim down forcefully. If he's having jerking movements, so don't hold it, because if you hold it here, they can have shoulder dislocation, or they can have a fracture also. So there is nothing you can do to stop those aggressive movements. If you go too near, they can actually hit you, and that blow is going to be powerful. And if the tongue is already bitten, most of the times, there is nothing you can do to protect it. Don't try to open their mouth, because if you happen to have your fingers into the mouth, and your part of fingers will be lost, and you can forget that part. So don't try to protect the tongue. The tongue is already has been bitten. So what you can do is you can cushion the victim's head. So hold on to their head and make sure they don't go and hit any physical object near. So you can also move the movable objects like chairs, tables, if they are nearby. You can move them so that the victim doesn't go and hit those things and fracture their body parts. So once the seizure stop, sometimes they won't actually be normal. So some people regain complete consciousness within 1 or 2 minutes. Some people take a few hours. So they will be very much confused. It's normal. So just move them to a hospital. So if they're unconscious, you can put them in recovery position. We have seen what is recovery position in the previous slide. So this is the recovery position. So anyone unconscious with a pulse, they should be put in the recovery position. Next kind of emergency is low blood pressure. If someone's blood pressure drops, they will have that dizziness and sweating, they will start to faint. So they might fall down onto the floor. What you can do is you can help them lie down slowly. Don't hold them and make them stand straight. Always they should lie down, and you can raise the victim's leg so that this blood supply can actually go to the brain and they get consciousness back. If they faint and fall down, sometimes they can have injuries. They need to be raised. They need to be checked. Next kind of emergency is burns. If you have a thermal burn, means that is because of a flame, you have to run cold water over that burn part so that the pain will be low, but do not apply any ice. If the burnt clothing, accessories, if the burnt part, say this part is burnt and they have a wristband or something, so in that case, that needs to be removed. Rings should be removed, because after some time, this body part will start to have a swelling and it will be very difficult to remove those parts later on. So any accessory should be removed as soon as possible, as long as they are not stuck to the skin. If they are stuck to the skin, don't try to forcefully peel it off. Let the doctors take care, move the victim to the hospital. So over-the-counter painkillers can actually help you. Whichever painkiller you have, you can use it. So don't use any ointment, butter, or some people have a tendency to use toothpaste. They will apply toothpaste and come. They will apply turmeric and then they come. So we are not trying to make a dish out of burnt part. Don't apply turmeric or some kind of masala. So it's not going to help. So it is going to actually make our job difficult at the hospital because we need to clean it. So you can try to apply food grade plastic. So if you have any food grade plastic wrap, so for example, I have a burn here. So I have to apply a thin strip like this. I have to apply strips of plastic that is going to help conserve my body fluid. So the moisture is intact in that area. But don't wrap it around, because if you wrap the plastic around, if there is a swelling, there is no place inside. So you are actually going to cause harm. So always put it in strips so that there is scope for expansion. If there is a blister, let it burst by itself. Do not break the blister. If it's a chemical burn, like because of acid or alkali, so the outside injury, what you see is small, but it keeps penetrating, going deep down into the body. So you have to put that part under running tap water for a long time, 20 to 30 minutes sometimes. You may have to put it under the running water. So some other emergencies we haven't covered is dog bite. Dog bite related, if you have a dog bite, first of all, prevention is better. That means do not disturb any sleeping dog or a dog with babies. So in that case, if you try to pelt a stone at the dog, sometimes the dog might run away, but if it starts running towards you, you will be running away. So in that case, if you happen to be bitten by a dog, there is one thing that matters, whether the dog is vaccinated or not. If it's vaccinated, most of the times you will only require first aid. And if the wound is big enough, maybe some stitches later on, not immediately. But if the dog is street dog, or it is not vaccinated, in that case, you will have to go through immunization. So rabies is preventable but not treatable. So it's better to get help. So rabies vaccine, if you take today, the protection will come down the lane after a month or so. So if you need immediate protection, there are something called immunoglobulins. So depending on wound, how big it is, if it's a small scratch, sometimes we may ask you to take vaccines. If it's a big one, we will ask you to take immunoglobulins. So always see a doctor before you go to a doctor. So the dog's saliva will contain rabies virus. So you have to put that bitten part under running water and wash it with soap and water continuously for 5 to 10 minutes. Then go to a hospital. If your neighbor says that the dog is already vaccinated, don't blindly trust them. Ask for a vaccination card. So if you see that it's vaccinated, then you can actually be at peace. Otherwise, once you get rabies, doesn't matter whether you have 100 crores of property, even if you are ready to put that all into the hospital's account, you're not going to get any help. So prevention is the only thing. So you have to actually get help at the hospital immediately. The other emergency is snake bite. Example, if snake is bitten here, so in that case, your poison will be carried via blood. If you panic and if your heart rate is high, so in that case, if the heart is pumping at a fast rate, blood will come here fast, blood will go back fast. That means this poison will reach the rest of the body fast. So some people have a habit of catching that snake. So they will think that we have to catch the snake and take it to the hospital so that they will treat based on that snake. You don't have to do that. Don't waste your time and don't risk another snake bite. So if the snake has bitten, let it go and you come to the hospital. We will be treating you based on your symptoms, not based on the snake. So sometimes not each snake will have equal load of venom. So if it has bitten 2 or 3 people before you, maybe the venom is out of stock in that snake. So in that case, giving you antidote is not ideal. So we have anti-snake venom available. So that can be given only if you have symptoms. So depends on what kind of symptoms you are facing. So always go to the nearest hospital. So let's see if we have any questions. So there is one question. Hello, doctor. How should we know if there is a blockage or leakage of blood supply? Which injection to be given in blockage if it confirms stroke? So there are some thrombolytic drugs, we call them. So if it's a blockage or leakage, that can be known only via imaging, means we do either CT or MRI scan. In that only we will come to know. If it's a leakage, CT will show immediately. If it's a blockage, CT will take some time to show it. In that case, MRI can be helpful. So sometimes the hospital will tell you to go ahead with CT because CT is very quick. It takes only 1 or 2 minutes to do a procedure. In that, if we see a bleed, then MRI is not required. But if CT does not show a leakage, that means it could be a blockage. That can be seen only in MRI. So if a hospital says, okay, they did CT, now they are doing MRI, it's all for money and all, that's the thought people start to get. But if it's a leakage, MRI cost can be saved. So only CT will be done. So it all depends. We go in a proper fashion. We go with CT first, then MRI. Nowadays, we are getting better MRI machines. So even MRI is quicker. Within 20 minutes, we are getting an MRI film. So before that, we used to have almost 40 minutes to 1 hour scans. During that time, only CT Even now, most of the facilities always go with CT first. If CT says there is a bleed, MRI is not required. If not, MRI is done after that. So they do it to actually diagnose fast, not to charge you double money. So next is, doctor, may I know for low blood pressure, any intramuscular injection for rapid restore BP to normal level? So low blood pressure, you will have to give IV fluids, and it all depends on why you are having a low blood pressure. Sometimes that low blood pressure could be due to weakening of your heart. So if it's because of weak function of the heart, you will need injections in the hospital, not intramuscular injections. Sometimes adrenaline can help, but again, it is a very powerful drug. So better reach the hospital immediately. So if you have any more questions, you can use the chat box or the QA section. So QA section is open for any queries. In case of drowning, again, there is, most of the movies show that you have to press on the stomach and all. Don't do that. So you are not supposed to press on the stomach if someone is drowning. So again, you will be only checking whether they're conscious or not. If they're conscious, move them to the hospital. And again, if someone is seen drowning, jump in only if you know swimming. Otherwise, two people will be requiring help. So save yourself first. If a building is on fire, let the fire personnel, rescue people get it, then only you try to help. So in epistaxis, ethamsulate injection useful. That's one of the things. So again, it depends on why that epistaxis is coming in. So if it's due to injury that caused a large bleed, so again, in that case, it may or may not help. So it all depends on case to case. So local adrenaline soaked gauze piece is going to be much more helpful. Or if it's a large one, you will have to apply some tamponade. But that's again all for medical people. This session is for non-medical. So we are not going to talk about injections and all. How to relieve from palpitations related to fear, panic, attack, severe. So if someone is having a panic attack, they tend to inhale fast. So if you inhale and exhale fast, if you're breathing rapidly, you will be losing your carbon dioxide from the body. So though carbon dioxide is a bad thing for us, again, everything needs to be in limits. If you lose out a lot of carbon dioxide, the blood supply to the brain is affected and you will start to faint. So to prevent that, you have to keep your breathing in control. If you're on the way to the hospital, you can actually try breathing into a plastic cover or paper bag. So breathe in, breathe out into the paper bag so that you will inhale your own CO2. That way, you can try to maintain some balance. One more question: is there any mandate that first aid will be done by private hospital free of cost? So most of the hospital, I'm not sure about the mandate, but most of the hospitals do first aid if it's a life-threatening or limb-threatening. During those scenarios, at least in Yashoda, if it's a limb or life-threatening situation, if something needs to be done immediately, say you're unconscious, by connecting you to a ventilator, if it's going to make a difference in your life, we tend to go ahead with intubation, and we don't wait for someone who can pay for that. So that initial part, most of the major hospitals do take care. Again, as long as it involves life or limb threatening. Simple abrasion, dressing and all, that needs to be most of the times paid. So anti-rabies vaccine, is it only available in government hospitals? No, even private hospitals have a stock of vaccines available. And there are some places in most of the cities which offer free of cost. But if it's far away, the vaccines are not that costly. And recently, the monoclonal antibodies, even they are not that costly. You can actually get them in any of the private institutions. Preventing heart attacks in the young age, it's not an easy task. So even recurrent checkups can sometimes be falsely alarming. So someone who had a very good test reports in the last week's health checkups, master health checkups, or whatever health checkup, can still have a heart attack. It all depends on so many factors. It's not easy to actually understand the reason behind everything. Okay, thank you so much for joining us and taking your time. This will be available as a recording on Facebook. So many students will come with hyperventilation and carpal tunnel spasm, serum calcium ionized calcium. What to do next? Again, you have to make them exercise so that the body starts to generate some CO2 and make them breathe into a paper bag so that the CO2 levels are maintained. Okay, so we can end.
Yeah. Thank you, Dr. Naveen. It's been a wonderful session, and the interaction from the people were also very nice. This session is available on Facebook also. There you can, those who have missed out or you wanted to inform to your friends, you can always inform to your friends to watch it on Facebook. And if they have any queries, they can post it onto the Facebook page, and so that we will get to know the questions asked, and we can easily reply via Facebook. So that is how we can be connected, and that will be useful for everybody. With this, I think it's very, very important that each and every citizen should be aware of all these things, because when there is an emergency, everybody will be in panic. That panic should be avoided, and you should always think what you have to do, and then you can do the best for both the patient as well as yourself. Sometimes what happens is, in your panicky situation, you may tend to do something wrong. That you should avoid. Just take a deep breath and then start doing the best. As I mentioned in the first, this one, if you're saving a life, you're going to save a family, and in turn, you're going to save a society. So that's the reason Yashoda Hospitals has brought this special program on first aid on the occasion of the World First Aid Day. Not only because it's a World First Aid Day, we always believe in teaching everyone regarding the first aid. And as I mentioned in the first line, each one should teach one to save more lives. Those who have watched this and those who want to watch this, they can always watch and tell other person also what they have to do in emergency, so that the message can be carried forward and it will reach the last person. Only when the last person understands what it is, then only the message will be loud and clear, and you're going to save, and you will be the hero. Thank you very much. With this, we'll close the session.
Yeah, I've shared the link on the chat box. You can share it with your colleagues or friends. If you want us to come to your community and conduct any first aid session training live in your presence, we can do that. Get in touch with our marketing teams. Thank you. Bye.